Welcome, everyone. We'll be getting started in just a few minutes.
Hello, everyone. Happy Tuesday, and welcome to the Conversation Project webinar, Bringing Advanced Care Conversations to Your Congregation. Thank you to everyone for joining us today. We're really excited to continue the Conversation Project to you and your different congregations. My name is Naomi Fedna, and I'll be your WebEx host for this webinar. While we're waiting for everyone to join us today, I just want to run through a few WebEx tips and tricks. If you have any questions or comments at any point during the call, feel free to type it into the chat box at the bottom of your screen and send it to all participants. You can also use the raise your hand icon, which is located on the right-hand side, and we'll be able to call on you to voice any questions or concerns that you might have or any comments. And if you're having any technical difficulties, please chat directly to the host. So in the same drop-down menu where you can select all participant, click chat to host, and the message will go directly to me, and I'll be able to help you out with any technical difficulties that you might be having. So before we dive right in, we want to know where people are joining us from. We know there are folks from all over who are joining the call. And so to get a sense where everyone's located, please point to where you're calling from on the map. To do this, use the arrow key in the upper left-hand corner of your screen, right above the WebEx presentation you're currently viewing, and click the arrow key and then click on the map where you're located. Great. Seems like we have people calling from Washington State, Nebraska, Georgia. We're over in Boston. Wonderful. It looks like we have a great group with us today. If you didn't get a chance to put your arrow on the map, please continue to type into the chat and let us know where you're calling from. We're really interested in learning more about where everybody's located. All right, so Rosemary, I'm going to hand the ball off to you, and you can take it away.
Thanks so much. Thanks so much, Naomi. And I'm just checking to make sure I'm not muted. Is that correct?
Yep, I can hear you.
Okay, I've lost my chat. Okay, well, good evening, everyone. It's great to be back with you tonight. I am Rosemary Lloyd, the advisor to Faith Communities for the Conversation Project. I'm delighted that tonight we will have a special guest joining us for part of our conversation this evening, and that is the Reverend Gloria White Hammond, who is the co-pastor of the Bethel AME Church in Boston, Massachusetts. Gloria is a colleague, and I consider her a friend. You might also be interested to know that she is a medical doctor, a pediatrician, as well as an ordained minister. Pastor Gloria currently serves with her husband as co-pastor of the Bethel AME Church, as I mentioned, in Boston. She is the Swartz Resident Practitioner in Ministry Studies at Harvard Divinity School and is co-teaching a course with the medical school and Harvard Divinity School on medicine and spirituality and healing. She's the founder and executive director of My Sister's Keeper, which is a very special ministry and outreach program in South Sudan and Africa. And she is here for so many good reasons, but especially because of the deep work that she has been doing in her congregation, championing a new ministry they have called Planning Ahead. So delighted to have Gloria with us, and she will be joining the call in a conversation with me in the second half of this session. Today, what we hope you will take away are some ideas and insights as always. So this evening we're going to be talking about pastoral care and how that is linked to advanced care planning conversations in congregations. So we hope you'll gain some insight into the role having the conversation can play in pastoral care, that you'll leave with some ideas for preparing lay teams to support others in your congregation on how to reflect on and express their wishes for care through the end of life. And I hope that we'll see that it might be a useful thing to use the Conversation Project's various conversation starter kits to support your pastoral care engagement in community. So our agenda is fairly straightforward. Tonight we'll be reviewing how the conversation starter kits work as pastoral care aids. We will be interested in hearing a little bit about and sharing with you how to assess what pastoral care means in your setting. We hope you'll reflect on who does it, when are people called in for pastoral care, or when do people reach out for pastoral care, how does communication work between and among various agents within a congregation to make sure that people are in the loop, as it were. And as I say, the second half of our call, we'll be talking with Reverend Gloria White-Hammond about the work she's been doing in advanced care planning conversations and how that relates to pastoral care. As we do each week, I just ask that if you have some burning question that arose out of the content from last week when we spoke about the role of sermons in encouraging the conversation and advanced care planning in your setting. We hope that we'll use the chat box to type in your questions or comments, and we will aim to weave answers into tonight's presentation. And if what you have is a comment, these comments, as you know, are collected and shared with the group after the call in a follow-up email. All along, we've been talking about action for change. We recognize that change takes place because people decide to take action. And we ask the question, what action do you want to take? We've been addressing how some of those actions take place in essentially three pockets or three buckets or three areas of work that are common to many congregations: sermons, pastoral care, and programming. Tonight, we'll be talking about pastoral care. Now, why is there a focus on pastoral care? Why do we lift that up in particular, separate from things like sermons or programs and activities in a congregation? Well, we realize that when people are in a healthcare crisis, not only do they turn to their healthcare providers for support and healing, people often turn to their clergy or faith leaders for support, guidance, accompaniment as they go through a journey of illness. Now, we know that many doctors are not trained in how to have conversations about serious or life-limiting illness. We're happy to say we're beginning to see some changes in that. Many more schools are committed to teaching excellent communication skills. But like doctors, as a clergy person myself, I can say that we are often not trained in a similar kind of way. We may have courses that are electives. Our ordination requirements might include doing CPE, which is Clinical Pastoral Education, which would have us be in a healthcare setting. But as much as we are maybe great at funerals, we don't often know just how to interact or intervene when it comes to serious or life-limiting illness. But the good news is that we can be encouraged. These conversations are human conversations, and really the kind of training that's required is just encouraging and supporting and amplifying qualities in a human being. And so we believe that this is something that we can be doing better. We know that we have to work to cultivate our capacity to provide pastoral care and be present with people as they go through serious illness, but that is something that we can do, and it can begin by developing our own capacity to face mortality and by exemplifying having the conversation for ourselves first as we prepare to lead and support others in having this conversation. So what are some of the ways that pastoral care can be cultivated, our capacity for doing and providing pastoral care? Well, as I mentioned, consider beginning with having the conversation yourself, using our conversation starter kit as a way to develop your capacity, to become familiar with what does it take to reflect on and articulate your own wishes, so you can recognize the blessing, the opportunity, but as well as the challenge of how to answer these questions. They're not always things, ideas that can slip off the end of your tongue readily when someone says, so tell me, what do you want? Knowing that you had to struggle with this, work on this, take time with this, pray over this, get some feedback on this, will help you as you lead others. But you can also offer or seek professional or volunteer training to develop your capacity for yourself if you're a clergy person, for staff, for lay leaders, and for congregants. Now, we know that some clergy or pastoral associates are particularly skilled or experienced in this area and can offer this training themselves to their staff or provide these kinds of workshops in their settings. But some of us may also need to hone our skills and ability to initiate, conduct, and conclude conversations. Also, not all faith leaders, all clergy leaders are inclined or able to carry this role. It could be because of a personal circumstance in the moment. It could be because of inclination. It could be because their role in a large or a multi-staff setting, their priority role is not to be doing pastoral care. So understanding how that works in your setting is very important. And being clear in your communication with your associates or your lay pastoral committees or leaders and with your congregants is important to be, it's important to be clear about that. So what are some of the ways that people do develop their pastoral care capacity? Well, there are retreats and seminars available for doing this as a professional, and it can be on end-of-life care issues and conversations or a more general pastoral care seminar. Again, if someone has the capacity, it could be a skilled person in your congregation or the faith leader, to offer a workshop for the pastoral care associates or healthcare committee folks or the HESED members, whatever that group is in your setting that helps in providing pastoral care or caring. There may be a caring committee. So this workshop could be on how to facilitate introducing or having the conversation with congregants they visit, perhaps. In our Getting Started guide, we offer other examples we've heard about for how to cultivate capacity to provide pastoral care in congregational settings. And it may be something a little unusual or more creative. We've heard about people who work with their cantors or music directors to recruit and train choir members to accompany the sick and dying with chanting or other music, things like threshold choirs. We'd be really interested to know if that's something that's going on in your congregation. People are interested in learning more about how that is working, and we'd like to be able to share if you've had some expertise or experience with that. We also think that given that the topic that we're working on is serious illness and advanced care planning, having conversations about wishes for care through the end of life, that as a pastoral leader, it's important to learn about definitions and documents, to learn about things like palliative and hospice care and know what the difference is so that you can be a good coach if someone comes to you and is worried about the kind of care they're getting or not getting, and be able to also direct people about the appropriate state-specific advanced care planning documents that are used. We're not going to go into depth about this evening, but I am going to paste into the chat right now, and we are also going to send this as a follow-up, just a little bit about what's the difference between palliative care and hospice care. This might be helpful for you to review. Very briefly, palliative is something that means to be soothing, calming, or relieving. And palliative care is a medical subspecialty. It's an interdisciplinary team. Very generally, it's appropriate for people at any age, regardless of the expected outcome of their illness, versus hospice, let's say, where it has been medically determined that a person is likely, or no one would be surprised if the person had between 6 and 12 months to live because of their advancing serious illness. In palliative care, physical symptoms are alleviated through medical means, and there's also a coordination of care for the entire family system. Support is provided. People are provided with decision-making assistance, and if you're getting palliative care, what people worry about, I understand, is that it's the same as hospice, that it means that they're dying, but in fact, it does not mean that. It means someone is living with a serious illness and that their symptoms can be alleviated, modified, and in some cases prevented. And a person who's receiving palliative care is receiving it because they do have a serious illness diagnosis, but they're also being treated with curative, lifelonging treatments. Whereas in hospice, which is also a medical care, it's medical care that will be helping people to manage life to the end. Medical care is provided, emotional support is provided, spiritual care is provided, not only to the person with the serious advancing illness, but to the members of their care team, their families, and as well. Whereas in palliative care, treatments can be used, or curative treatments are being used. In hospice care, it is being given to a person when their illness is no longer responding to treatments for a cure, and instead we're working to keep people comfortable and as alert as they want to be, balancing that out between comfort and alertness. Hospice and palliative care work on emotional support. In hospice, people are focusing a little more on clarifying their priorities and establishing their goals while providing relief from pain and other symptoms. So we've given you some pointers here in the chat that you can look at later, but to learn about that for yourself too, so that you can be clear when people are wanting to know more, or if they're telling you, well, we are on, our family member has been moved to hospice care now. And it's also a way to saying to folks that you're interacting with who may be ill and not getting the kind of pain relief or spiritual, emotional relief they're looking for, have you considered a palliative care consult, and being able to be clear with them that you're not suggesting they're going on to hospice, but to help them integrate their care in such a way as to receive palliation. And I mentioned that it's important that we be thinking about or knowing about our state-specific advanced care planning documents. And because there are so many differences in each state, I'm not going to take time now to delineate all of those, but I'm posting into the chat right now two good references for you to find your state-specific documents. One is at medicare.gov, and the link is there for you. And there's also one through AARP that has some caregiving, but also some financial and legal document information as well. I hope that's helpful for you. And as always, if you have questions or comments that you would like to post as we go along, Naomi will be helping me to monitor the chat so that we can be seeing what's going on and hopefully responding to you in a reasonable way. Although, Naomi, I'm going to just let you know there's something has happened to my view bar, and I'm not able to scroll. So if you see comments, please jump in. Thank you.
Sure, I'll do that.
Okay, so one of the things we have talked about in our Getting Started guide is one of the ways to deal with pastoral resources, pastoral care, is to provide resources for folks. And we know that in some congregations, people have worked hard to develop or update a library of documents pertaining to end-of-life care and wishes. So we encourage you that if this is something that you decide to do, you don't have to reinvent the wheel. There are lots of websites out there that help you to understand what your state-specific documents are. There are probably partners in your particular region who want to help you know more about hospice resources that are available, as well as funeral and burial practices and resources that you could be providing inside of your congregation so that people know that your congregation is someplace they can turn to find out this information, or you know where to direct them. If you're going to do this and take this on, the one thing to keep in mind is that you want to be sorting out ways that not only will you collect this information, but how you will display it. Will this be print or will this be digital? How will you update it, and who will be responsible for doing that, ensuring that you have accurate materials as they are updated either by your state or by practice in your particular faith community. I think there's nothing sadder than when you walk into a congregation and you see some great displays and then you realize that some of this stuff is so dated that it's actually no longer helpful. So knowing that you start a program, you want to ask yourself, how will we also sustain this program? Of course, we also hope that you will have make available website links and or printed copies of our various conversation starter kits to share as appropriate with congregants. We know that some of my colleagues keep them in their office on the coffee table so that when people come in, they just see them spread out there and they pick them up, or in the waiting room or waiting space outside an office. Others display them in their narthex or lobby, someplace where people are gathering. How would you find that useful? Where do people come looking for print materials, or can you develop the capacity on your website to have a special section? We've been hearing about congregations that are making entire pages related to end-of-life healthcare decision-making, funeral planning, burial practices, ethics, so that it's something you can shop for, quote-unquote shop, internally in from a trusted source. Thanks, Ron, for chatting in. We were talking about palliative care, that he would like to remind us that a palliative care team will include a doctor, an advanced practice nurse, as well as a chaplain. Thanks very much. Interdisciplinary is an important way to go when it comes to palliative and hospice care as well. Now, one of the assignments for your pre-work this evening, we had suggested that you go online to the conversationproject.org and take a look for and then a look at some of our other starter kits. We had in our first session, we went over the what we call our flagship original starter kit on how to have a conversation, but we've also produced additional kits over time. So there's one that is designed specifically for circles of care, families where someone has Alzheimer's disease or dementia. And we have a pediatric kit that's not in our more advanced formatting yet, but the content is still very excellent. It is for the parents of seriously ill children. Now, the reason I wanted to bring your attention to these is that I think that while they have a special focus for populations, one for people with Alzheimer's disease or dementia, the other for children, they both have a way of framing the conversation that gives you some useful stories and or frames for how to enter a conversation in a way that could be helpful reminders to anyone in any situation regarding serious illness and having the conversation. For example, in the kit for folks with Alzheimer's disease or other forms of dementia, there is the reminder to keep the person with the disease process at the center of your conversations. Even when people can no longer communicate well, it's not about what I want or what you want. We want to always turn the conversation when we're talking with one another, say siblings or talking about a parent, and say, well, what is it that Dad would say now? Or I remember Mom saying this. Is that what you remember too? So keeping your person, the patient, at the center. Also in the Alzheimer's kit, it reminds you to take these conversations in small bites. It doesn't have to happen all at once. The same thing is true for a lot of pastoral care. It doesn't have to be a marathon meeting. It can be some short conversations over time. The conversation, it's a reminder in both those kits, is a conversation that happens sooner rather than later. It's always a good idea. And that the conversation about what matters most is important not only for the person with a disease process, but also for the caregiver. That person knows what matters most to the person being cared for and helps to relieve the burden and the decision-making because it's a shared conversation about what matters, and the caregiver can be preserving a voice, preserving the person's autonomy, and not, in some cases we hear, not feeling guilty for decisions that were made because they were making decisions based on what the person wanted. And also in the Alzheimer's kit, the reminder that you need to have this conversation along a spectrum of illness, of wellness and illness. So those are good reminders no matter who you're talking with or when you're doing pastoral care. Similarly, in the pediatric kit, there's some great reminders in general about doing pastoral care in a congregational setting. It's particular to children, and I think it's general to others. Let the person with the illness lead the way. Let them be the ones who help raise the conversation or raise the concern and try and follow it. So if a child or someone else worries that the doctors may not be able to cure me, our answer is not, oh, don't worry, it'll be okay. But it's like, so you're worried that the doctors may not be able to cure you. Let's talk about that. Help children, help others record their wishes for care and share it with their healthcare team. So it may take sitting down with someone and really listening and helping them to articulate that and being their recording secretary and then their advocate to the healthcare system. A good reminder from the pediatric kit, and it's interesting, but I think we all need to be reminded of this. Talking about it doesn't make it happen, okay? We heard from so many parents that that was a concern, and it's not logical, it's deeply emotional, it's ingrained in so many of it, but it's true. Talking about it does not make it happen. In the pediatric kit, we remind you that every child is unique and so are their wishes, and that is general to not just children, but to everyone. So take a look at both of those starter kits, because I think the frames and the conversations and the stories that are in them will help you in thinking about the kinds of conversations you would have with anyone. And it also gives you some preparation and some readiness to share those kits at the appropriate time with people who have specific needs. I've just finally hit send on the information I put into the chat, so you should see it up there now. There is some information about the distinction between palliative and hospice care, as well as 2 links to places where you can find state-by-state documents for healthcare. And I also want to just highlight that Audrey Marsh chatted in when we were talking about digital and print resources, that in their setting she found that it was important to offer both print and digital resources, since so many of our seniors either have no computer and or access, so we make them both available. Great point, Audrey. Thanks so much. There is a digital divide still, and we need to be aware of that. So please continue chatting in, offering observations and your questions, because now I'd like to move into a conversation with the wonderful Reverend Gloria White-Hammond. Hi, Gloria.
Hi, how are you?
I'm well. Thank you for being here this evening.
Well,
so, Gloria, I thought we could just have a little conversation together and have our participants listen in, and as they have questions, we hope that they'll chat them into the box and we can pose those to you as well. But I'd like to just start off with a little bit of an introduction. I mentioned before that you're a doctor as well as a minister. I just wondered if you would talk to us a little about the different way you approach healing as a minister.
Sure. Well, first of all, let me say good evening to all my colleagues. I've enjoyed listening to the webinars over the last few weeks, so thank you. You've been an encouragement to me. Yeah, I definitely think of my narrative with regard to individuals is to think in terms of the complexities. I think Western medicine, especially in more contemporaneous times, think of the separation of large groups, body, mind, spirit. But I very much think of individuals as representing all of those, and any illness in any category can be manifested in the other. So emotional illness can be manifested as physical illness, and I think it's critical to approach individuals from that complexity.
Mm-hmm. Great. Absolutely. And that's so much part of what happens in palliative and hospice care. I heard someone talk today about the idea that someday they hope that all care will be palliative care, all medicine, all medical care will be palliative care, or there won't have to be a specialty, because everyone will recognize what you've just spoken about, the integration of the whole being.
And actually what we find too, Rosemary, is that when patients want their spiritual needs addressed, and when those needs are at least acknowledged, that patients feel like they have better outcomes and they're more satisfied with the quality of care. So we're going to get there.
I think so. I think so. So clergy have different ways of approaching pastoral care in their settings, and I know you can't know what they all are, but I bet you have some insights, and you can certainly talk to us about your own setting, about how you address pastoral care, and also, if you wouldn't mind telling us a little bit about how you engage lay leaders in pastoral care, or others besides yourselves and Pastor Ray. Do you have a systematic way of training pastoral associates in your setting at Bethel?
We do. First of all, let me just give you a sense of our congregation. Our usual attendance is about 350. We're largely African American, and our membership is close to 700. We do have employed other people in our pastoral team. We have a full-time assistant pastor, a youth pastor, but we very much rely on our congregation, and that to provide really congregational care. And there's a text in Christian in one of the books that says that there are people who are called to be pastors and apostles and teachers, but their calling is to equip the members to essentially do ministry to one another. So we very much rely on a congregational care model. We encourage people to be in small groups, and those individuals in small groups provide a lot of the pastoral support for each other. We also have individuals who go through what we call what's known as the Stevens ministry, and I suspect that many people on the call are familiar with Stevens Ministries. It's a very rigorous training program that supports congregants to really come alongside other congregants when they're in crises of various sorts, and we have found that extremely helpful. I will say there are many situations in the congregation about which I'm not aware of the details, because between the Stephen ministers and small group members, they're taking care of one another.
That's wonderful to hear. I talked earlier about this idea that it can't always be the senior clergy who are doing all the pastoral care, and it sounds as though at Bethel AME in Boston, you have found a way to really call out and call on those who are inclined to this kind of caring ministry in your congregation to support one another.
That's right. And again, within a congregation, I may not be trained to be the fancy pastoral support person, but I do know how to love someone. I know how to show up when they have a need, and that's really the kind of equipping that we are talking about. You asked about individuals, lay leaders who have now been trained to provide some of the work that we're doing in terms of advanced care planning. There are now 8 of us that are involved. 2 of them are ministers, and the other 6 are lay persons. We have someone who is an elementary school teacher, someone else who has done some social work, someone who's a nanny. So there are individuals who have developed a passion for supporting our members to have the conversation and do advanced care planning, and that we were introduced them to the work, and they're passionate about it. And again, they're the ones who are taking the real lead on supporting our members to have these conversations.
Because it really is a human conversation. I love that there's a nanny that's one of the people who's doing this, because who could be more patient and more, and as you say, more loving, which is a big way that we provide pastoral care, is to love others.
That's right.
And to just really shine that love in a time of need. So you mentioned that you have I mentioned that you have a program, and it's called Planning Ahead. And I wonder if you could just give our listeners an overview about the program that you're doing there. And you've talked about the numbers of lay members. So what do they do, and what do you do? But first of all, just an overview about what is Planning Ahead.
So Planning Ahead is this developed, as you know well, Rosemary, out of our interaction with you all at the Conversation Project, and we are now do a cohort that meets once a month for 3 months. The first month, we walk right through the Conversation Project starter kit and help individuals to tee up the conversation that they will have with a loved one about what some of their wishes are. Then we have them come back in the second month, and we introduce them to an advanced care, advanced planning document. We use 5 wishes. We've tried a number of different documents over these past 3 years, and right now we've settled on 5 wishes that we found is an easy tool to teach people. We actually do some of the 5 wishes training and completing the document in the session. And again, we send them out with and encourage them to at least try it. We have them come back a month later, and we do a celebration. For whatever you've done, if you had a conversation, we celebrated. If you did 5 wishes, we celebrated. If you just registered, we celebrate it, and people come and they bring their family members. They get these little trophies, and the pastor comes out and gives them a certificate, and that just means so much. It's like a big party to celebrate whatever they've done to advance the conversation. We've now had about 175 people who've been through that, and again, because our usual attendance is 350, that's enough to change the culture. So we've been we do one in the fall, one in the winter, one in the spring. We take time off during the summer, but because it's an ongoing part of the ministry, people will come in when they're ready to, sometimes prompted by a crisis. We've had some young couples prompted by pregnancies who come in, but it's now a part of the culture, and so now when we say planning ahead, people understand it, and increasingly it's like, well, what, you haven't done any planning ahead? How does that work? So that's been critical.
What a shift. So that's taken you a couple of years to get to that point. In the beginning, was it an easy, quote, sell? Was it easy to convince people that they should try this? Or did it take a little bit of a, come on, folks, let's get to this?
Well, it was interesting, Rosemary, when we invited you, it was 3 years ago, and I just put the call out there in general, and I thought maybe we'll get, 15 people. And as you remember, we had 45 people and who went through that. So what we discovered is that, in fact, there was already an interest there, and we've been able to build on that from there. What we found when just doing this approach and using the starter kit, that by the end of 3 months, that virtually everybody says they've had a conversation with someone, and they all feel more comfortable having conversations. That's for sure.
That's wonderful. So if you were to offer some advice to folks who wanted to be starting this kind of a program, what are 3 tips that come to mind?
Okay, well, first of all, you got to do it yourself, right?
Okay.
And I've not done that when you first came to Bethel. So you've got to do it yourself. Start small. Even if it's just 5 people, start with that 5 people. Each one of them at some point will become a champion. And stay with the process in terms of providing support. And sometimes it's hard work because it not only brings up fears about dying, but it especially the way you all do the conversation starter kit, which is so helpful, is it brings up issues in terms of relationships that need to be dealt with. So it requires ongoing pastoral support. And identify your champions who will carry the message forward and will do the teaching. And again, we have found it important to just keep a cohort going so that it's not just a one-off. And if I miss this, then I can't enter in again, but just keep it going so it becomes an ongoing part of ministry, just like the choir is an ongoing part of ministry, or the Bible study is an ongoing part of ministry. Keep it going.
Wow, that's great advice. I love hearing someone else besides me say it without prompting, because I have felt that way for a long time, that I've had some colleagues sometimes suggest that, well, we did death last year, we don't have to do it this year, do we? And I'm like, well, don't you do forgiveness every year? Don't you do love every year? It feels to me that people come to this at different times in their lives, and we want to be there and ready to meet them with this when they need us.
Whenever, if they have a situation, either something personally or something that they've seen, or it just clicks, and then they're ready to do it. And again, for me, this has been a critical piece of providing pastoral support for individuals, even when they're well, right? And we've learned a lot from doing this. I think one of the most important lessons that I've learned that has been helpful to our congregation is when one of our members who developed lung cancer was transitioning, and at the point that it was clear that there was no more medication to offer, she said the one thing that she appreciated, the gift, and the sad thing, of course, was that she had the disease and she was going to die, but the gift was that she realized for the first time that every day really was a gift, and that if she had lived her life in appreciation for the death that was inevitable, that she would have made some very different decisions and made some different choices. So she was most grateful for each new day, and that's been a powerful testimony for people in our congregation and that's a legacy that she's left us, is that
Yes.
ongoing reminder. We say her name and people know to appreciate each day.
Beautiful. What is her name?
Her name is Jackie.
Jackie. Well, thank you, Jackie, for sharing that legacy through Gloria's voice. We're grateful to you for sharing that story and for Jackie being able to give voice to that. Very often I do talk about this idea that when we cultivate a subtle day-to-day awareness of our mortality, it is a spiritual practice, one that allows us to live life more fully every day. And it's one of the reasons I'm so grateful that this conversation is being adopted and infused in so many congregations. There's always so much to do in a congregation as a leader. There's so many topics that are pressing. When I think of pastoral care from the days of my ministry, I know that it could include needing housing support or needing treatment intervention for various kinds of addiction. That this sometimes would fall, the idea of preparing for the end of life seemed like, well, that's not as pressing, is it? You know, I mean, we've got some real suffering going on here. But what I'm hearing you say is that there's a way of bringing this, what seems like a difficult or dark even conversation, into the life of a congregation to the benefit of so many people, to really enhance their lives, which is what we're trying to do all the time.
Yeah, and that is so true. And again, from a pastoral perspective, I'd say one of the most valuable, there are a couple of things that have been especially valuable. One is having people share what some of their desires might be in terms of comfort or dignity at the end of life. And another thing that Jackie taught us, one of the things that she wanted was to have socks. She always used, it's really important for her to have her socks, her feet covered. And her sister, who at some point recognized she couldn't reverse the diagnosis or the prognosis, but her big thing was that she kept socks on her sister. And she felt like that was such a gift for her to be able to provide that kind of joy to her dying sister. So that's important. And again, this idea of recognizing the challenging relationships that make transitioning so messy. Through this process, we've been able to help people identify those and begin the work before it becomes a critical issue, but begin that work of forgiveness and reconciliation. And so this kit is more than just a nice thing to do. It is programmatically, like I said, it's been key to our pastoral support for our members. So thank you, Conversation Project.
Thank you, Gloria, for that. I love that her sister was able to derive moments of joy in providing something as simple as keeping socks on her sister. And she was able to do that because her sister told her that was important, that was something that might not come up. You know, you may have been sisters long ago living together, but, you know, you grow up and you don't live together. You may not know your sister really cares about her socks unless you've had that kind of a conversation. And the idea that if we, again, that cultivating the awareness of our mortality and think, how do I want it to be at the end? Oh, I want my relationships to be right. I want them to be healed. Well, what do you need to do now then, working backwards to make that get to the place you want to be so that you're dying feeling whole and complete and without regrets, so you can have that peace of heart and mind that so many people say is crucial to them at the end. Absolutely. I think it's why we gather, it's why we pray, it's why we sing, it's why we do this on a week-to-week basis.
Yeah.
So thank you for highlighting that.
Yep. Thank you.
I want to just thank you. I just want to take a look in our chat and see if, so Paul is saying that's what I like so much about 5 wishes. You tell people what's important to you and what you want for comfort. Yes. What do you want for comfort? What specifically means comfort to you? What specifically means dignity to you? I had a conversation starter kit workshop one time with a man. He says, okay, I know what I want. I want to die with dignity. And I looked at him, I said, and? And he said, no, I want to die with dignity. I said, well, you know, that's wonderful. And I think it's so important, and we're really glad you shared that. Now, can you help us know what that looks like for you?
Yeah.
You know, if someone says, I want music, I'm like, great. Could you give us a hint about your playlist, or do you want your 14-year-old nephew to choose the playlist for you? You know, it's let's get specific. It's part of the conversation.
Yeah,
wonderful.
Absolutely. I'd say there's maybe one other thing if I can offer another.
Please, yeah.
One of the other things that we have now especially been highlighting in our congregation is to have people engage with us from the point of diagnosis. I think one of the hardest times to enter into a patient's course is, in fact, when they're at end of life. It's a critical piece, but it's often hard. And so I've been encouraging our members and other clergy persons to get involved at the point of diagnosis, and so that it's really a journey, and that from diagnosis through the treatment, when we're still not sure of the outcome, hopefully to wellness, and as we understand, not necessarily so. And I'm hoping that as more pastors get involved in those earlier stages, that it will contribute to a more collaborative interaction, even with clinicians in the hospital, and so that we can again contribute to the ongoing work of getting well. Me as a pastor working with my congregant, and you as a clinician working with your patient. But we are finding, as we're doing that more with our members, that the entire process is much more satisfying. Sometimes still not easy, but made easier because we're at least collaborating around the care.
Beautiful, beautiful. Well, may it be so. And Pastor Gloria, thank you so much for joining us tonight. I'm going to just remind people that we have a few more minutes. If you have a specific question for Pastor Gloria you would like her to address, or any comments from your own experience of doing pastoral care in your setting, or challenges that you have in doing pastoral care in your setting, we'd be looking in the chat for those comments and questions now. And I would like to just bring us closer to our end for this session by reminding you for your getting started, I call this action and accountability. We could also call it homework, to just remind you, if you haven't had a chance, to please review the Conversation Project's special conversation kits designed for people with Alzheimer's disease or dementia and for the parents of seriously ill children. I do think you'll find these helpful for yourself to look through, and also as resources for those very challenging situations. Our next call, we are going to be talking about programming in congregations as one of the ways to bring advanced care planning conversations to your congregations. I'd love for you all to be thinking about what kinds of programs your congregation has offered on end-of-life care and advanced care planning. What's worked? What's been challenging? What has been a great surprise success? And by what measure or measures was that program considered successful? How did you know? What ideas for programming have you seen that you could imagine offering in your setting? So just to do some pre-thinking about that, we would love to know what has been working, what you imagine doing, and what you have questions about, like how would you go about doing this? Our next session will be on programming next Tuesday night at 8 p.m. Eastern. And on that call, we will be joined by Audrey Marsh from St. John the Evangelist Roman Catholic Church in Columbia, Maryland. Audrey has been a lay leader in her large congregation and has brought a program similar to Planning Ahead. It's called Your Gift of Peace, and she'll be with us to talk about how they planned and implemented and measured their success of that very important and influential program. I remind you once again that before shutting down your computer, once you close out of this WebEx, a survey will pop up. We would very much appreciate each time your feedback on the content and delivery of these calls. So please let us know what's been useful, what you wish had been there, what you hope you'll hear about in a follow-up call. And we hope that you will have a beautiful week, everyone. Let me leave you with this final quote from the beloved writer Maya Angelou, who said, "I've learned that people will forget what you said. People will forget what you did, but people will never forget how you made them feel." Thanks, everyone. Have a good evening. See you next week. Good night.